Testosterone is known as a male hormone, but did you know the benefits reach far beyond that? Dr. Jenny Wilkins from Age Vital now joins us to fill us in on all this. Of course, testosterone is for men, right?
Yeah, I mean, that's what makes man manly, right? And we want manly men, but testosterone is the sexy hormone.
Yeah.
You know, and a lot of women don't realize that we have testosterone too. This is where we get our libido. This is what makes women want to, you know, attack their guys.
Okay, so it is a hormone.
Yep, it's a hormone.
It's in both men and women.
In both men and women, yep.
And how do we become deficient?
You become deficient as you age. So that's what actually starts the aging process, is a lack of hormones. So you start getting wrinkles, your hair starts falling out, you get hot flashes, you get night sweats, you start losing your muscle, the collagen in your skin. There's so much that testosterone does, you know, to help you look young and feel young. So,
but I'm sure women would think, oh boy, if I get some supplementation of testosterone, I'm going to start growing hair where I don't want to grow it and start feeling like a man. Is that
That's
true?
always the first question. Yeah,
Okay.
they think they're going to turn into men or grow something weird, you know, and I'm like, no, 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 you're not going to turn into a guy. Let's test you to see where your levels are. So, and we test doing saliva, we do this during blood work or urine. Then once the levels come back, we can see exactly where they are. Now, women don't need testosterone levels that men have. When guys do it, they're taking 200, you know, 150, 200, 350 milligrams a week.
Right.
Women are taking 1 to 10 milligrams, you know, a day, as opposed to, you know, massive amounts. Now, if they took the amount of a guy, yeah, then they'll start, you know, resembling some masculine type properties, which is not what you want.
If they're given too much, but it has to be administered properly, obviously.
Exactly, yeah. And
how does one ingest or how do you get supplementation of testosterone?
I make it in a form that is the most comfortable for whoever my clients are. And a lot of doctors will have patients that want it injected. It's easy just to do it once a week. I have doctors that do the pellets. So it's a little incision and they do it right in the fatty area in the tush.
That's what I do.
Yep, and they do capsules, I do troches, sublingual drops, I do creams. So I mean, there's a amount of rapid dissolving tablets. That's the form that I personally take, and it's great. And your hair grows in beautifully, your nails grow in beautifully. But most of all, it makes, you know, both men and women swing off the chandeliers. You know.
Woo! Okay. Well, there you go. Now, is this expensive?
Nope. Testosterone's very affordable. If you're doing the injectable format, is probably the least, you know, the most expensive. You're talking anywhere from $90 to maybe $200 for a vial, a 10 ml vial, which will last you about 10 weeks to 20 weeks, depending on, you know, the directions and how often you take it. Half an ml to 1 ml. And so, and I believe the pellets are slightly more too, depending on the doctor that you go to. But the least expensive format would be creams or capsules or troches or rapid dissolving tablets. You're talking about $1 a day.
Yeah, right.
So,
very
30,
affordable.
So even without insurance, you know, because some insurances don't pay for things, you know, preventative type substances, right?
And you know, it's funny because I think a lot of people out there will be surprised who don't know that testosterone is for women as well. So this is a good thing.
Yeah. Women everywhere need it. Yep. And it's so great for cognitive function. You give a guy a shot of testosterone and he's just feeling, like really run down, very tired. And the moment you give him a shot of testosterone, a week later he comes in there, he's got a girlfriend on his arm, you know, he's like, you know, I got my testosterone intact now, you know. And then women the same way, you know, they're not, it's amazing how many women don't climax, you know, during, you know, sexual activity. But then the moment you give them testosterone, they're like, oh my gosh, I've never enjoyed sex so much. You know, thank you so much, Dr. Jenny, you know, for introducing me, you know.
Another perk. There you go. All right,
it
Dr.
doesn't stop. Yep.
Thank you so much. And if you want more information on what Dr. Jenny's talking about here, you can reach her and her team at Age Vital at 1-888-388-7237 or the website agevital.com. Thanks so much again, Dr. Jenny. All right, we'll be right back.